A very warm good morning to all of you. At the outset, a warm World Health Day wishes to all the citizens across the globe. Myself is Joby George. I'm working as a nurse researcher in a tertiary hospital of Northern India. I'm also working as a regional faculty lead for India of the Global Health Network of Oxford University, London. Thank you very much, my team of Global Health Network, for giving this great opportunity to speak on the occasion of World Health Day. Next slide, please. In my small presentation of 30 minutes, I'll just try to wrap up some of the great initiatives that the world is currently undergoing. What is Global Health Network? Since I'm a nurse, we have an exclusive network for nurses that's called Global Research Nurses Network. Some of the initiatives of United Nations and WHO for the achievement of health for all by the year 2030. Some of the challenges that we have faced for conducting of research in low middle income countries. What is the role of regional faculties and some of the solutions for overcoming the challenges, and a call for action for all the public health researchers across the globe for the achievement of phenomenal health for all the citizens. Global Health Network was set up in 2010 with a core operational funding from Bill and Melinda Gates Foundation, which is operating from Center for Tropical Medicine, University of Oxford, London. It is coordinated by Professor Trudy Lang and a team of excellent researchers to accelerate and streamline research through its innovative digital platform. It's an online science park that allows researchers to work together without any geographical, institutional, or financial barriers. Burden Trust for Nursing. It is a trust for nursing in United Kingdom, which is funding the Global Research Nurses Network, which aims to support nursing contribution by building nursing research capacity, by building nurse leadership capacity, and supporting local nurse-led initiatives are some of the contributions of Burden Trust for Nursing. The recent initiative by the Burden Trust for Nursing, called Nursing Now 2020, is a global initiative aiming to raise the profile and status of nurses in all the aspects of their career. And I'm very happy to say that it is jointly collaboration. It's a collaborative effort by the International Council of Nurses and World Health Organization. It is estimated that the nurses and midwives represent nearly 1/2 of the total number of healthcare workers. In order to address the goal 3 of the United Nations Sustainable Development Goals, that is health and well-being, it is estimated that the world will need an additional 9 million nurses and midwives by the year 2030. The world and the international organizations have taken a great initiative for seeing a successful and healthy 2030. Next slide, please. As I mentioned, that the Sustainable Development Goals is a universal call to action to end poverty, protect planet, and ensure people to live in peace, prosperity, and in phenomenal health. As a healthcare researchers, our third aim is for the good health and well-being of the citizens. Therefore, the United Nations Development Program has worked actively with the United Nations Development Group in developing a strategy for effective and coherent implementation and support of this agenda under the acronym Mainstreaming Acceleration Policy Support, which is otherwise known as MAPS. Next slide. I'll just try to wrap up what is research and how the research is important on a daily life. In today's e-world, where artificial intelligence and human robots pave significant contribution, information technology has almost revolutionized humans so far. Therefore, for every individual searches, we do everything search, but we act on something. Thus, every research is an instrument to gather information, and every research is often driven by curiosity. So that curiosity enables for getting a question, and for getting a question, and after getting a question, we will inquire for an answer, and therefore the research policy happens. Therefore, research broadly defined is a systematic search for answers to questions about facts and the relationship between and among the facts. Next slide, please. As I mentioned earlier, the Global Health Trials is an online science park which provides innovative and digital discussions forums, platforms for guidance, and it consists of tools and resources. We have a regional faculties group which lies between the research and the researchers, where the research cannot be accessed, cannot be accessible. We have a professional membership scheme which is very active, and it is being taken by all the researchers across the globe. We are having excellent opportunities, events and opportunities. There is a global health training center wherein you can find all the activities, all the information, all the announcements of the training and activities and opportunities that is happening all over the globe. Next slide, please. I'm very proud that during the emergencies of Zika virus, for the prevention of malaria, dengue, and other communicable diseases, Global Health Network has wonderfully supported and contributed for the prevention of these deadliest diseases across the globe. Some of the network that has been actively working for these diseases is a Zika plan. Zika plan is a contribution from 5 continents, 13 from Europe, 7 from South America, 3 from North America, 1 from Africa, and 1 from Asia. And I'm very proud to say that Professor Trudy Lang, working at Nuffield Center for Tropical Medicine, is a member of this consortium and that actively works for the prevention of Zika. The Worldwide Anti-Malarial Resistance Network and the Global Dengue Lab and the Non-Communicable Diseases Network is an exclusive example of the active contribution of Global Health Network for its citizens in terms of an outbreak of such deadliest diseases. And thank you very much for the Global Health Network contribution in overcoming this disease burden and in providing a healthiest and safest place across the globe. Next slide, please. As I told that we lies between the research and researchers through the regional faculties. In remote settings where there is non-accessible areas, the regional faculties operates from their own region through diverse background and expertise. They provide regional presence by sharing skills and knowledge at local level, and we are operating from many countries like from Cameroon, Namibia, South America, South Africa, India, and Kenya, as well. These regional faculties, they build research capacity development by running skill sharing open workshops within the region. They collaborate with their individual universities or institutions by organizing small meetings, journal clubs. They encourage the researchers. They encourage the persons for writing blogs, for writing articles, reviewing e-learning courses, and of course, participating in our e-learning courses in the professional membership scheme. And the main aim of this regional faculties is to create the local networks of the research group so that the research capacity development can be encouraged in that particular area. Next slide, please. We offer networking. That networking helps you to advance your career. It is crucially connected to the quality patient care. During my daily literature search, I loved an article by a nurse on the American Nursing Today, Rose O. Sherman and Tanya M. Cohen. They wonderfully elaborated why the nursing networks matter. She's telling that networks help you to advance your career, provide high quality care, and support your colleagues. Building a professional network can take two paths: a network in your immediate clinical environment or one created through an organization. Professional networking has a professional image and being prepared, and which is positively, and networking is about planting, not by hunting. I loved the article of these two nurses, so I just thought to mention in my presentation so that the networking helps in the research capacity in whatsoever area that is inaccessible, when the research is inaccessible. We provide resource and support. We provided online learning opportunities. We provide many numerous open access journals, and of course a professional membership scheme wherein you can develop, wherein you can able to develop your career opportunities through this professional membership scheme. Process map as well as SiteFinder are some of the great contribution of Global Health Network for the health researchers across the globe. In SiteFinder, you can find any potential site for your specified interest, for finding your potential site, so that you can also participate in that site. And process map is an A to Z of the clinical research, that is from the starting of the study till the closeout. You will find all the steps have been wonderfully elaborated in this process map. They're having many short courses. They're having many courses that has been improved for the introduction of clinical research. The ICGCP is also being involved in the professional membership scheme. Next slide, please. Therefore, the main aim of this global health network is to accelerate and streamline research where the research is not accessible, and it is a productive and interactive environment where the research teams are accessing peers and generate research documents free of cost. The Global Health Network can transform research by enabling researchers to share methods across staff levels, communities, regions, disciplines of global health. And this is happening by enabling the theory of communities of practice. Therefore, why research? Research is an inevitable because it lays strong foundation for the root cause analysis of many underlying diseases. Research brings progress and prosperity, since health research is vital because it will benefit the society as a whole. A good research is ethical, feasible, responsible, and interesting. A good research builds paths to science, innovation, and nation building. Research is necessary to achieve, as I told, sustainable development goals. It increases great collaboration and mutual understanding. Clinical trials and studies are essential to the progress of evidence-based medicine. Therefore, research is an important aspect in every job aspect of a healthcare healthcare professional. Next slide, please. We conduct research capacity. We improve research capacity by organizing skill sharing workshops. We have done many skill sharing workshops, and we have conducted many skill sharing workshops in the major cities of India, like Gujarat, Bhopal, Kerala, Mumbai, Tamil Nadu, and in countries like Nepal. We organize competition for improving the participation of nurses into research in many countries like Kenya and India as well. Therefore, we improve this research capacity by this skill sharing workshops, and that is totally free of cost, so that the research capacity development can be happened in that particular region, and that will enable the nurses, that will enable the healthcare professional of that particular region to think and act upon research. Research is nothing but we aim to create a feeling among the healthcare professional that research is nothing but it is an inquiry of what you do daily. Next slide, please. Well, there are certain challenges that we face for conducting this research in low middle income countries. In somewhere the administration is not interested in research. And well, as a nurse, I often see that the nurses think that it is not the part of their job because they lack confidence in research skills. They think that for doing research, they need high-end degrees, and they lack education in evidence-based practice. They feel that there is lack of confidence in their research skills to build up their research skills. There is a steep learning curve. Statistical language is not at all understandable to them. And of course, research takes time. The time costs money, which must be budgeted, and that might be one of the reasons for conducting of the research in the low middle income countries. Next slide, please. Therefore, in order to facilitate these challenges, we have to create generate interest in the evidence-based medicine. Nursing research is nothing but it's a systematic approach used to examine the phenomena to nursing and nurses. It is important that clinical practice be based on scientific knowledge. Evidence generated by nursing research provides support for quality and cost effectiveness of nursing interventions. The educators must prepare healthcare professionals to have an appreciation of research. Some nurses I've seen that, yes, they just asked me that what is the benefit of doing research while I am engaging in my day-to-day daily work. So what's the benefit? So the educators or the administration must appreciate their research work. Healthcare administrators must facilitate an environment that fosters intellectual curiosity and support research efforts. The startup initiatives and funding for healthcare professionals, specifically for nurses, must be encouraged upon. The businessman or the philanthropist must spend on the nurses to empower on the research and its activities. The administration should organize the nursing team should organize small journal clubs and meetings to understand the need of the hour. Nurses, therefore, in nutshell, nurses must be elevated from consumers, the producers of research, so that evidence-based findings translates to health policy and decisions. Next slide, please. Therefore, 7 principles of good practice in research capacity strengthening is that network, collaborate, communicate, and share experiences. To understand the local context and accurately evaluate existing research capacity building. To ensure local ownership and secure active support from the healthcare workers. Building monitoring, evaluation, and learning from the start. Establish robust research governance and support structure and promote effective leadership. Embedded strong support, supervision, and mentorship opportunities must be encouraged upon. Thinking long-term, flexible, and plan for a continuity for the actions that the hospitals and the research to be planned are some of the 7 principles of a good practice in research capacity in strengthening. Next slide, please. I want to provide special encouragement to the members of the public to join as partners in our research as we strive to ensure that we are addressing the healthcare needs and priority of the families and communities we serve. The path is worthy. The only thing is that we have to understand the state of the science at hand, as well as strategies that can be behind effective utilization of evidence and implementation of change. Whether you are a nurse, you are a physician, you are a public health nurse, you are a pharmacist, let's work together to make the healthcare accessible, to make the healthcare more phenomenal to all the citizens across the globe, and therefore it is enabling as Arthur Ashe said, start where you are, use what you have, and do what you can. Maybe that you are having limitations, but you have to overcome that limitations from whatever resources you have. You have to come upon and be an active member for providing healthcare healthcare opportunities for all the citizens in your region. Next slide, please. As I told that it's a collaborative effort. It's a collaborative effort by the citizens. It's a collaborative effort by non-governmental organizations. The religious institutions should take up the effort. The government and the agencies should think about this, that this is a collaborative effort, and everyone should give equal participation. The Residents Welfare Association, including the schools and colleges, must be empowered for creating health awareness among the citizens, so that our road to 2030 is not impossible, but it is possible through active support of all the citizens and all the healthcare researchers across the globe. Next slide, please. Therefore, everyone can be involved in this endeavor by sharing resources, by sharing experiences, offer advice, building confidence, and communicating to each one of us, so that that strong network can be created, so that professional networks are always crucially connected for the quality patient care. My call to all the researchers that let's work together, be the ambassadors of the researchers, and work together for making our society, for making our system a research led system, wherein scientific contribution can be made by each and every healthcare professional across the globe. Therefore, do not waste the time. Therefore, be actively involved in the network. You can just log into www.theglobalhealthnetwork.org. Within fraction of seconds, you would become the member, and your wider opportunities, and you are into the world of wider opportunities, networking opportunities. People might say that what's the need of just logging into this network? But yes, when you get into this network, you will find active opportunity. You will find active interest in generating evidence. You will find an active interest in asking a research question. You will find an interest in asking a question based on your day-to-day practice. Let's move ahead. My full-time support to the Global Health Network for all the endeavors in the days ahead. Thank you very much for the Global Health Network team of researchers for their active involvement in the community participation, community development, and citizens-oriented programs. I wish them all the very best. Once again, thank you very much for giving this opportunity. Next slide, please. Next slide, please. My sincere acknowledgement to Professor Trudy Lang, who is heading the Global Health Network, Dr. Iveta, my colleague, Dr. Leandra, Tamsin, Liam, and Alex, and the entire team of Vibrating Global Health Network. Thanks to University of Oxford and the funding of Bill and Melinda Gates Foundation. Thank you very much for giving this great opportunity. It was wonderful and lovely to talk from India to all the citizens across the globe on the occasion of World Health Day. Once again, my best wishes to all, and my best wishes for all for leading a phenomenal and happy life. Thank you very, very much.